Well, we're here with Dr. Michaels, dentist in Oconomowoc in Wisconsin. Do I pronounce that right, Dr. Michaels, Oconomowoc?
Yes, Helmut, that's very close. Thank you.
Okay. Well, Dr. Michaels, you're a dentist. Tell us a little bit. You see, some as patients, as non-dentists, some of us think that a dentist is a dentist is a dentist is a dentist. And while there's probably some truth to it, I'm sure there are also some differences. Tell us a little bit about the philosophy in your practice, because different dentists run different philosophies. They have, some dentists have many operations and procedures, such as root canal, periodontal disease, gum disease, or whatever it might be, implants under one house, other ones don't so much. Tell us a little bit about that, and perhaps Dr. Michaels, tell us what made you becoming a dentist.
When I was a boy, I had a very nice dentist as a kid, and he encouraged me to consider dentistry, and I was very happy that he guided me in that direction, because I absolutely love being a dentist. I enjoy working with my hands. I like science. I like being with people. I like helping people. Well, dentistry is an excellent fit for me.
Yeah, well, that sounds like a good reason. If you're working, obviously dentistry is I think dentistry, like many professions, but very much it's visible in dentistry that, yes, it's science all the way through. At the same time, it's very artistic. You've got to be very artful in it. Is that true?
Oh, yes, that's absolutely true. You need to have an excellent eye. You need to have good hand skills, the ability to work well with your hands, be detailed-oriented, and maybe most importantly, really care about people and want to help them.
Sure, absolutely. That's with no doubt. So in your practice, what is your philosophy? Are you trying to put everybody a Julia Robertson, Brad Smith, Tom Cruise type of smile on it? Or is it geared towards functionability, where make it as nice as possible, but most importantly, make it working so that there are no new disease coming up, that one can keep the teeth forever rather than having to pay huge amounts for implants down the road? What's your main clientele there? What can they expect when they come to your practice?
They can expect to be treated as an individual. My objective, my philosophy is to give the patient what they want, to treat them in a manner that they want to be treated. So the first thing we do is get to know the person and find out what their philosophy is, find out what they want to accomplish, and then my job is to satisfy their goals. Some people want to have that Hollywood smile. Some people are more interested in functionality. Some people want to do it get it done, but do it as least expensively as possible. So people are all very different, and my job is to get to know them and help them to accomplish what it is that they want.
Wonderful.
We call that the platinum rule. It's to treat people the way that they want to be treated.
Wow. That's great. So basically, even in dentistry, even though it's probably not a sandwich shop where you kind of just say what you want, there are some doctors' orders, some doctors' opinions of what's good for you, but in between there are options for the patients, and you try to comply with those patients' wishes, give the patients the option and say, look, here is what we do, but here's what you need to do in order to stay healthy, and here's what you can do in order to look prettier. That's basically what it is.
Well, an individual will come into the office, and frequently they have a specific problem which requires attention. And sometimes they have problems that they're completely unaware of. Right. So my job is to inform them, help them understand what all their options are, explain what the advantages and disadvantages of every option may be, and then together we talk and determine what's best for them based on their situation and their circumstances. I'm their trusted advisor. They can come here and trust that I will always be completely fair and honest with them and share with them all of the possibilities and what the advantages and disadvantages of each possibility are. And then together we form a union of thought and action and accomplish things properly for them.
Beautiful. A meeting of the mind, that's important. Now, in your practice, are you doing root canals? Are you doing periodontal disease? Are you doing implants? Are you doing those type of things?
We have a wonderful staff, a beautiful clinic, and we have the state-of-the-art equipment. We are capable of providing the finest dentistry in all manner that anyone could possibly need.
Got it. So he comes to you. He's not going to be shoved around to 6 other offices in order to get.
No, I want this. Exactly. I want this to be their dental home forever. This is the place where they can come to have things taken care of for them in a manner that they want.
Well, wonderful. Thanks for letting us know, and we're going to have more conversations here about some specific problems, procedures, which maybe patients would want to know and should be educated in. Thanks a lot, Dr. Michaels.
Thank you, Helmut.